You know that feeling when you want to really get something complex, understand what makes it tick, but without getting lost in a mountain of technical details?
Yeah, absolutely.
That's precisely what we're diving into today. Anterior uveitis in cats. We've got a stack of information, and our mission is to pull out the crucial insights so you come away feeling genuinely well-informed about this feline eye condition.
Absolutely. We're looking at a condition, anterior uveitis,
Hmm.
which is essentially inflammation in the front of the cat's eye, specifically the iris, the color part,
Okay.
and the ciliary body, which produces the fluid inside. What's important to remember is that this inflammation can sometimes be connected to issues in the back of the eye as well, affecting the retina.
Ah, okay.
And it can pop up in one eye or both.
Okay, so what's the fundamental issue here? What's actually going wrong inside the eye to cause the inflammation?
Well, at the heart of it is a disruption of the blood-aqueous barrier. Think of the eye as a carefully controlled environment, maybe like a sealed terrarium. This barrier is kind of like the glass, selectively keeping certain components in and others out of the eye's fluid, which is called the aqueous humor.
Okay.
When this barrier breaks down, like a crack in the glass, proteins and cells from the bloodstream leak into the aqueous humor, and that's what triggers the inflammation.
That makes sense. So this crack in the eye's barrier, what could cause that? It sounds like there could be a lot of different things leading to it.
You're right, there's a wide range of potential culprits. The sources highlight infections. These can be fungal, protozoal, bacterial, viral, or even parasitic.
Oh.
Then we have immune system reactions, tumors, direct injuries to the eye, and even certain metabolic imbalances in the body.
So, like, give me an example.
Yeah, for instance, a common protozoal parasite called Toxoplasma gondii
Hmm?
can cause this, or something maybe more straightforward, like an accidental blow to the eye. Trauma.
Wow, that's quite a list. Is this something that vets see relatively often in their feline patients?
It is a fairly common condition in cats.
Yeah. While we don't have exact statistics, what's interesting is that where you and your cat live can actually influence the types of underlying infections that are more likely to be involved.
Really? How so?
Well, certain infections are just more prevalent in specific geographic areas, so location matters.
That's a fascinating point about location. Are some cats maybe more susceptible to developing anterior uveitis than others? Like age or gender?
The data suggests that while it can occur in cats of any age, it's more frequently diagnosed in the, let's say, 7 to 9-year-old age group.
Okay, middle age to older.
Exactly. And perhaps surprisingly, male cats, particularly those who've been neutered, seem to be more prone to it compared to female cats.
Huh, interesting. Now, if you're a cat owner, what are the kinds of things you might actually see that would make you concerned about your cat's eyes? What are the red flags?
Right. An owner might first notice that one or both of their cat's eyes look, well, cloudy or unusually red.
The cat might also show signs of eye pain, like squinting, maybe pawing or rubbing at its eye, or seeming more sensitive to bright light.
That makes sense.
In some cases, you might even notice a change in their vision. However, it's worth noting that the signs of pain and redness in cats with uveitis are often more subtle than what you might see in a dog with a similar issue.
Oh, really? So less obvious than in dogs.
Generally, yes, a bit more subtle.
So if a cat owner does spot something concerning and takes their cat to the vet, what are some of the key things the vet will be looking for during a thorough eye examination?
Well, the vet will first assess for those telltale signs of discomfort, like the squinting and increased sensitivity to light we mentioned.
Right.
They'll also check for any discharge from the eye, which is typically watery, although it can sometimes be a bit thicker. Redness of the conjunctiva, that's the pink tissue lining the eye, is another common finding.
Okay.
They'll also look for swelling of the cornea, the clear front surface of the eye, which can range from just a subtle haze to significant cloudiness.
And I recall reading about something called keratic precipitates. What are those exactly? Sounds technical.
Yeah, KPs.
Yeah.
Think of those as tiny clusters of inflammatory cells that have basically settled and stuck to the inner surface of the cornea.
Ah, okay. Like little specks.
Exactly. Vets often see these more clearly on the lower part of the cornea.
Right.
They'll also be looking for aqueous flare and cells. Now imagine shining a flashlight through a dark room filled with dust.
Yeah.
The beam becomes visible because of the dust particles, right?
Right.
Similarly, when a vet shines a narrow beam of light into the eye, inflammation causes a similar kind of dustiness or cloudiness in the aqueous humor, which makes the light beam visible. That's the flare in the cells they're seeing.
That's a really helpful way to visualize that. Okay. What other signs might they spot?
They might observe a ciliary flush, which is a distinct pattern of redness in the blood vessels specifically around the edge of the cornea. They might also see new blood vessels growing into the normally clear outer part of the cornea. The pupil, the black center of the eye, might be smaller than usual. We call that miosis, and might not widen properly in dim light.
Doesn't react well.
Right. In some instances, the iris itself might appear thickened or even have small bumps or nodules on it. Interestingly, the pressure inside the eye might actually be lower than normal in cats with uveitis, although this isn't always the case.
Lower pressure. That seems counterintuitive for inflammation.
It does, but initially the inflammation can disrupt fluid production, leading to lower pressure. Later, it can cause issues that raise the pressure, like glaucoma.
Ah, okay. There were also some more technical terms mentioned, like posterior synechia. What does that refer to?
That refers to adhesions, basically a sticking together between the iris and the lens, which sits just behind it.
Okay, sticking. Not good.
Not good. The vet might also see fibrin, which is a protein that can leak into the eye's fluid during inflammation, sometimes looking like strands or clots. And they could see accumulations of white blood cells, which we call hypopyon, or red blood cells, known as hyphema, often settling at the bottom of the front chamber of the eye like sediment.
Hypopyon and hyphema. Got it. And what happens if this inflammation becomes a chronic, long-term problem? Are there lasting effects on the eye?
Yes, unfortunately, if anterior uveitis becomes chronic, it can lead to several long-term changes. These can include alterations of the color of the iris, the development of growths on the iris, cataracts forming within the lens.
Oh, wow.
The lens becoming dislocated, changes in the shape of the pupil, an increase in the eye pressure leading to secondary glaucoma, and in severe long-standing cases, even shrinking of the entire eyeball, a condition called physis bulbi.
Physis bulbi, that sounds serious.
It is. The eye basically becomes non-functional and shrinks.
We've covered what anterior uveitis is and how to spot it. Now let's really dig into the why. We touched on the causes earlier, but can we get into more specific examples of what can trigger this inflammation?
Absolutely. When we look at infectious causes, it's quite a diverse group. Fungal infections that can be involved include things like blastomyces, cryptococcus, coccidioids, and histoplasma. Often depends on geography, like we said.
Those regional fungi.
Exactly. Among protozoal causes, Toxoplasma is a significant one, as is Leishmania in some areas. Bacterial infections like Bartonella cat, scratch fever associated, and Mycobacterium can also play a role, as can general blood infections, sepsis.
Okay. And viruses?
Viral culprits include the feline immunodeficiency virus, FIV, feline leukemia virus, FeLV, feline coronavirus, which is linked to FIP.
Ah, FIP. That's a big one.
It is, and also feline herpes virus 1, FHV1, and even certain types of migrating parasite larvae in the eye can trigger this inflammatory response. So you see, a wide range of microscopic invaders can be responsible.
That's a significant number of potential infectious agents. What happens when vets can't pinpoint a specific infectious cause after testing?
Well, in a significant number of cases, despite a thorough investigation, the underlying cause remains unidentified. This is what we refer to as idiopathic uveitis, meaning of unknown origin.
So just happens.
Essentially. Interestingly, in these idiopathic cases, examining the types of inflammatory cells present, maybe through a fluid sample, often reveals specific patterns, like a prevalence of lymphocytes and plasma cells. This suggests an immune-mediated component, even if the initial trigger isn't clear.
And we also mentioned immune-related causes directly. How do those come into play if it's not an initial infection driving it?
One specific type of immune-mediated uveitis is a reaction to the eye's own lens proteins.
The body attacking itself.
Kind of, yes. This can sometimes occur after the development of a cataract, where the normally hidden lens proteins get exposed to the immune system, or maybe following some kind of injury to the lens. The body's own defenses then mistakenly attack these proteins, leading to inflammation.
Sadly, cancer can affect almost any part of the body. Can it also cause uveitis in cats?
Yes, neoplastic causes, meaning those related to tumors, are definitely a concern. This can involve primary tumors that originate within the eye itself, such as melanoma or sarcoma.
Okay.
Or it can be due to cancers that have spread to the eye from other parts of the body metastasis. Lymphoma is a particularly common example of a systemic cancer that can affect the eyes this way.
Right. Lymphoma often goes systemic. And you also listed metabolic issues as potential triggers for uveitis. How does that work?
That's correct. Certain metabolic conditions can create an environment within the body that makes uveitis more likely. These include things like abnormally high levels of fats in the blood hyperlipidemia.
Okay.
a thickening of the blood itself called hyperviscosity, and elevated blood pressure, hypertension.
Hypertension in cats, right. And finally, the catch-all miscellaneous category. What kind of things fall under that umbrella?
This includes pretty much any form of trauma to the eye, whether it's a blunt injury or a penetrating wound. Severe corneal ulcers or infections of the cornea can also trigger a cascade of inflammation that leads to uveitis.
So an infection on the eye leads to inflammation inside the eye.
Exactly. The inflammation spreads inwards. And even severe systemic toxic states, where the body is overwhelmed by toxins for some reason, can sometimes manifest as inflammation within the eye.
Given this really extensive list of potential causes, I mean, wow, it must feel like a bit of a detective story for veterinarians trying to figure out what's going on in a cat with anterior uveitis. How do they approach the diagnostic process?
It really is detective work. The initial and absolutely crucial step is to carefully rule out other eye conditions that can mimic the signs of uveitis.
Like what?
For example, conjunctivitis, which is inflammation of the outer lining of the eye, the pink part. That usually presents with more superficial redness, maybe a thicker, often mucus-like discharge.
Okay.
And the pain associated with it might be temporarily relieved by numbing eye drops, which isn't typically the case for the deeper pain of uveitis.
Ah, that's a key difference.
It can be. Glaucoma, a condition of high eye pressure, usually involves a dilated pupil, which is often the opposite of what we see with uveitis, at least initially.
Right, you said uveitis often has a small pupil.
Correct. Corneal ulcers, which are open sores on the cornea, can be identified using a special fluorescent dye, fluorescein stain, and again, numbing drops might provide some temporary pain relief.
Okay.
And Horner's syndrome, which is a neurological thing involving a droopy eyelid and a smaller pupil, doesn't typically involve pain or eye discharge. So it's all about looking for those key differentiating signs during the exam.
So it's about piecing together the specific clues from the eye exam itself. What about laboratory tests? Are blood and urine tests helpful in identifying the underlying cause?
Absolutely. Standard blood tests, like a CBC and chemistry panel, and urine tests are a fundamental part of the diagnostic workup. Abnormalities in these tests can often provide valuable clues about what might be going on systemically.
Like what kind of clues?
For instance, elevated levels of certain proteins in the blood, like globulins, could suggest an underlying chronic inflammatory or infectious process somewhere in the body, or changes in white blood cell counts.
Gotcha. And are there more specific blood tests that vets might order to look for those infectious agents we discussed earlier, like FIV or toxo?
Yes, definitely. There are specific blood tests available to screen for some of the common infectious causes of uveitis in cats, such as feline leukemia virus, FeLV, feline immunodeficiency virus, FIV, feline coronavirus for FIP risk, Toxoplasma gondii, and Bartonella. These tests help narrow down whether an infection is a likely trigger.
What about imaging techniques like X-rays or ultrasounds? When might a vet need to look beyond just the eye itself or blood tests?
Imaging can be very important. For example, chest X-rays might be recommended to look for evidence of an underlying disease process in the chest cavity, such as certain fungal infections, which can show up in the lungs, or even signs of cancer that could have spread.
Makes sense.
And if the inside of the eye is too cloudy due to the inflammation, to get a clear view during a standard examination.
Which it often might be, right?
It often is. An ocular ultrasound can be incredibly helpful then. This uses sound waves to allow the vet to visualize the structures within the eye, even through the cloudiness, and look for things like tumors, retinal detachment, or lens problems that might be contributing to or resulting from the uveitis.
So ultrasound can see through the haze. And are there any more invasive diagnostic procedures that might be necessary to get a definitive diagnosis?
Yes, in some cases, more direct sampling might be needed. Measuring the pressure inside the eye, a procedure called tonometry, is crucial. Like we said, while high pressure suggests glaucoma, a lower than normal pressure can be a supportive finding for uveitis.
Okay.
In certain situations, a veterinarian, usually a specialist ophthalmologist, might take a small fluid sample from inside the anterior chamber, the front part of the eye that's called an aqueous centesis, or even from the vitreous humor, the gel-like substance in the back of the eye.
Wow, okay.
These fluid samples can then be analyzed, sent to a lab to look for the presence of infectious agents directly, or abnormal cells like cancer cells. And in rare cases, if an eye unfortunately needs to be removed due to severe disease or blindness, examining a tissue sample, a biopsy under a microscope can provide valuable information about the specific type of inflammation and potentially identify the underlying cause definitively.
So quite a thorough process, potentially. Once a diagnosis of anterior uveitis is made, or at least strongly suspected, what's the primary approach to treatment? What are the main goals?
Well, the two main goals of treatment are, one, to reduce the damaging inflammation within the eye, and two, crucially, to address any underlying cause that has been identified through that diagnostic process.
Right. Treat the cause if you can find it.
Exactly. And client education is paramount here because, as we've discussed, there could be serious systemic diseases involved, making appropriate and sometimes prolonged treatment essential for the cat's overall health, not just the eye. In most cases, the initial treatment involves medications that can be administered at home on an outpatient basis.
Okay. What kinds of medications are typically used to combat the inflammation itself?
Corticosteroids are really a cornerstone of anti-inflammatory treatment for uveitis. These powerful drugs can be administered as topical eye drops or ointments directly onto the surface of the eye.
Okay.
And in more severe or systemic cases, oral corticosteroids, like prednisolone pills, might also be necessary. Examples of topical corticosteroids commonly used include prednisolone acetate, which penetrates the eye well, and dexamethasone.
Are there any precautions with steroids?
Yes, a big one. It's vital to remember that systemic corticosteroids, the oral ones, are generally avoided until infectious causes of the uveitis have been thoroughly ruled out or are being treated concurrently. Because steroids suppress the immune system, they could potentially worsen an underlying infection if you don't know it's there.
Ah, okay. That's important. What about other anti-inflammatories?
Non-steroidal anti-inflammatory drugs, or NSAIDs, are another class of medications used to manage inflammation. These can also be given topically as eye drops, or systemically via injection or orally.
Like meloxicam.
Exactly. Meloxicam is a common systemic one for cats. Examples of topical NSAIDs include flurbiprofen or diclofenac drops. However, there are important considerations regarding potential side effects, particularly with systemic NSAIDs in cats concerning their kidneys and stomach, so their use is often for a limited duration and requires careful monitoring.
Right. Always cautious with NSAIDs in cats. I also saw mention of pupil dilating eye drops in the material. What's the purpose of using those in the treatment of uveitis?
Right, those are called mydriatics. Pupil dilating eye drops, such as atropine, serve two really important purposes in treating uveitis. First, they help to relieve the pain associated with the inflammation by relaxing the ciliary muscle spasm inside the eye.
Okay. Pain relief.
Yes. And second, they help to prevent the development of certain complications, specifically the iris sticking to the lens that posterior synecdoche we talked about by keeping the pupil wide.
Ah, keeps things moving.
Kind of, yes.
Yeah.
Prevents sticking. In cats, ointments containing atropine are often preferred over liquid drops because they tend to cause less excessive salivation or drooling, which cats really dislike.
Good tip. Are there any medications that should absolutely be avoided or used with extreme caution in cats with uveitis?
Yes, definitely some contraindications. Medications that constrict the pupil, called miotics, sometimes used for glaucoma like latanoprost, should generally be avoided as they can worsen inflammation and pain in active uveitis.
Okay, no pupil constrictors.
Correct. Also, topical corticosteroids, the drops or ointments, and especially subconjunctival corticosteroid injections under the eyelid lining should never be used if there's an active corneal ulcer present. Steroids can severely delay or prevent ulcer healing and even make it worse.
Very important point. Check for ulcers first.
Always. And as we touched on earlier, systemic NSAIDs should be used very cautiously and ideally avoided altogether in cats with pre-existing kidney disease due to the potential for exacerbating kidney issues.
Got it. So once treatment has started, how do veterinarians monitor the cat's progress and adjust the treatment plan as needed? It's not just give meds and see you later.
Oh, definitely not.
Yeah.
Regular follow-up eye examinations are absolutely essential. Initially, these rechecks might be scheduled quite frequently, perhaps every 3 to 7 days, depending on the severity of the uveitis.
What are they checking for?
During these recheck appointments, they're assessing the level of inflammation. Is the flare reducing, or the cells clearing? Is the redness improving? And the pressure inside the eye should be carefully monitored using tonometry to watch for the development of secondary glaucoma, which could be a serious complication requiring different treatment.
So watching for that pressure spike.
Exactly. The frequency of later follow-up exams will depend on how well the cat is responding to the initial treatment. It often requires tapering medications slowly over weeks or even months.
We've discussed potential long-term changes if uveitis isn't well controlled. Are there other complications that can arise during or after treatment for anterior uveitis?
Yes, unfortunately. In addition to the long-term changes we mentioned earlier, like cataracts and iris changes, several other ophthalmic complications can occur. Secondary glaucoma is a big one. Also, dislocation of the lens from its normal position, retinal detachment, which can cause sudden blindness, and ultimately that shrinking of the eyeball, phthisis bulbi.
So vision loss is a real risk.
A significant risk, yes. And it's also crucial to remember that systemic complications can arise from whatever underlying condition is causing the uveitis in the first place. If it's FIP or cancer or a systemic infection, those have their own serious consequences. So addressing the root cause is vital for the overall health of the cat, not just the eye.
So considering all of this, the complexity, the potential causes, the complications, what's the general outlook or prognosis for a cat diagnosed with anterior uveitis?
Well, the prognosis for anterior uveitis in cats is generally considered guarded, at least for vision in the affected eye or eyes.
Hmm.
It really hinges on identifying and effectively treating the underlying cause, if possible, and how well the individual cat responds to the prescribed anti-inflammatory treatment.
So it varies a lot.
It really does. Cats with treatable underlying infections, for example, toxoplasmosis, which can respond to specific antibiotics, often have a better chance of a positive outcome for their vision compared to cats where the cause remains idiopathic unknown, or those with underlying conditions that are difficult or impossible to treat effectively, like advanced FIP or FeLV or metastatic cancer.
It's clear that anterior uveitis in cats is a really multifaceted condition, isn't it? With a wide array of potential triggers and potentially serious consequences if not promptly and properly diagnosed and managed. It really emphasizes how important a thorough diagnostic workup is when a cat presents with eye problems.
Absolutely. It just underscores the intricate connection between what might initially appear to be just a localized eye issue and potential underlying systemic diseases affecting the entire body. Taking a holistic view of the cat's health is paramount in these cases to achieve the best possible outcome.
And it really makes you think, doesn't it? Given the sheer number of potential things that can throw the delicate balance of the eye into inflammation, from tiny infectious organisms to complex immune responses and even the shadow of cancer, what does that tell us about the incredible complexity of our feline companion's health? And it really highlights the detective work and challenges involved in pinpointing the exact root of an illness when so many bodily systems are interconnected. A fascinating and maybe sobering thought to consider.